join when they join. I hope there's no echo. So for those of you who don't know me, I'm Helena Harnick. I'm the Executive Director of the Farm Testing to Targeted Treatments Program. I'm so happy to see you today. If you're new to the Town Hall meeting, the approach of the Town Hall is to share an update of what we have been doing as a collaborative program. You could go to the next slide, please. I can share with you the agenda. So the way that it works is I will start with a quick overview of recent achievements. And then from about a few months ago, we had changed a little bit of the format of the Town Hall to have the opportunity to actually invite all of you to be able to provide some input into a specific area of work. So today we would like to propose diving in a little bit more deeply into the area of supporting healthcare professionals. And we have been doing a lot of great work, and you have been participating a lot to understand the different needs, and we wanted to share with you some insights here and to discuss the next step with you. So that will be the second point on the agenda. And then we will go back to the high-level overview on what's going on elsewhere in the program, so you can have a good sense of what's happening, and then we'll just end with a reminder of how to get involved. If you have any questions or comments or anything like that, feel free to raise your hand, or indeed we're a small group, so you're welcome to speak up. We'll try to pause as we go through to give you the chance to react. One of the things that we wanted to share with you, we're really happy. We had celebrated this at ESMO, but we're really pleased to welcome 2 new members into the FT3 membership. We have Pierre Fabre and also the Patient Advocate Foundation. So we're really happy that you have joined us, and it is demonstration of the growing reach and reinforced diversity of the FT3 membership. And the fact that the partnership and working in partnership with patient communities continues to be important for us. So I wanted to start with that good news, and then if we can move forward to just the next slide. This is just a quick recap of the different activity areas that we work in. The FT3 members had identified 3 different goal areas where we are seeking to make change when it comes to improving access to precision medicine so that the patient could benefit. So we're looking to tackle access issues at the health system level, secondly at the care level, and also we play a role to try to unify and accelerate the ecosystem. Basically, this means we're trying to figure out what are the kinds of interventions and best practices that work in different country models or different contexts, and to be able to make that replicable in other country contexts or other people facing similar situations. So this is just a reminder of what we're trying to do, but we will take each of these in turn and go more deeply into what exactly we have been doing here. So if we can go, I think it's just the next slide. We just have, there we go. We have an overview of what we have been doing since the last time we were here together in the Town Hall. One of the points I wanted to share was we had the pleasure of attending the UICC World Cancer Congress in September, right after ESMO, where we presented a virtual abstract on learnings from the country pilot program, and it was really great to have FT3 represented there. We have also been doing a lot of work, as I mentioned before, on understanding healthcare professional support needs at different points along the patient pathway. And we also had the great opportunity for these outcomes to be presented at ESMO. And as I mentioned in the section, soon after this, we will be explaining to you in more detail exactly what those outcomes were and what was presented. And then I have a couple of other highlights in the biomarker test report project. The final results disclosure tool is validated to meet the need of comprehensive results disclosure in clinical practice from both patient and healthcare professional perspectives. And we also have a new update underway of the initiative page on precision medicine synapse, which is now allowing to highlight linked items and showcasing a latest news section. And on that note, I also wanted to add that we are looking at improving even more precision medicine synapse, and we're actually looking at how we can make it easier for you to be able to navigate to the most relevant information for you, such as by country model or different kinds of barrier needs. And we hope to be able to come back with you an update on that in the next few weeks as well. So with that, I would like to actually hand over to Lidabai because she is going to explain to you a little bit more about what we were doing at the FT3 meeting, which took place right before ESMO. Actually, you can move to the next slide. And you can see from the pictures here that we had a lot of fun and that we had a lot of good discussions. So I'm going to hand over to Leadavai, and she will walk you through the approach and some of the things that came out of this meeting.
Thank you, Elena. And as you can see, we had a lot of different people from different countries here to be part of a very engaging workshop. So if you can go to the next slide, please. We had a session where we discussed together different archetypes, looking at how to group different countries to identify strategies to accelerate patient access in different settings. As you may know, there are many variables that you can consider looking at patient-centered access. Some of the key variables are related to public reimbursement when it comes to financial access, but also adoption when it comes to access more at the care level. So we have used this kind of simplified metrics looking at those two variables to group countries in a similar situation. So here on the y-axis, you see the public reimbursement that relates to covering of testing and targeted treatments. And of course, there's some variability there in disease areas and testing. And then on the x-axis, we have adoption, which is more about integration into care practices. So this is a kind of framework that we worked with. And then as a group, we brought together speakers from different countries and different examples and looked at what are the key strategies and challenges and good practices to help accelerate access in countries in such a situation. So if you go to the next slide, please. These are some of the high-level learnings from the group work. I won't go to all of it, but basically, if you are in a country, for example, with a moderate access, meaning, for example, you have high public reimbursement, but not like adoption at the care level yet, then you may look at, okay, what can we do at the care level? And it was suggested to really start with oncologists as they're ordering tests for patients, and to really look at a reference center or a hospital that is a role model and can inspire others to build infrastructures and expertise to scale the accessibility. So this is the way we approached it, looking at different situations and then the different challenges and strategies in those specific archetypes. And we have like different examples from different countries and speakers that have shared with us the examples in their situation. So if you're interested in learning more, I'm happy to connect with you, and we are building on this to also share what are the key challenges and how may you use this as a tool to accelerate access in your situation or in your context. So that is a bit of background. I'm just looking around to see if I see anyone who was at the community of practice, to see if there's anyone who would like to comment or share a little bit of their learnings from the workshop. Just checking in. I don't want to put people on the spot, but if you were there and you want to say a few words about the workshop, I know Ivica was there and Petra, I believe, was there. Feel free to just jump in. No specific comments? Okay. Well, then I suggest we move on to the next section.
Yes, thank you so much, Lidebay. This is, as Elena anticipated, a deep dive into one of our projects, which is the Support HCPs project. And the long-term objective that we have here is to enhance the ability of the different healthcare professionals to implement personalized medicine at the point of care effectively by addressing their challenges and their support needs. And so in order to reach this objective, we've started by mapping out how does the current, and if you go to the next slide, thank you, Vincent, how does the current healthcare pathway look like, especially for oncology patients, and how could the ideal pathway look like? And we've looked into what are the different phases that the patient would go into, and then what are the different steps within these phases that patients need to undergo within their care journey, starting from the screening up until the treatment is delivered. And so from this, then we understood that there are several HCPs that are involved in the precision medicine patient pathway, and we've started mapping them out. In the next slide, you can just see an example of how many different healthcare professionals interact within the pathway and in which phases are they interacting. And one thing that we understood through a literature review and through some of the initial conversations is that there is often unclarity on the roles that are played by the different team members within the healthcare professional team. And this fragmentation, of course, is impacting patient outcomes. And so we went a level deeper and we looked into each of these stakeholders, and still through publications and through initial conversations, we tried to in the healthcare pathway and what could their ideal role look like. So what is the potential of each of these stakeholders? How could they support in the end, again, to facilitate better patient outcomes and the access of patients to the right treatment at the right time? And through this journey, we realized there are two particular figures within the healthcare professionals teams that we could focus on, as they have a high potential to support other HCPs, and they're often not necessarily standardly involved within the pathway, which are the pathologists and the nurses. So we went again one level deeper, and we started to work on a deep dive to really understand what is the current and ideal role within each phase of the stakeholders, and what are the different challenges that they face. And I would like to hand it over to my colleague Silvia that will walk you through an example of this deep dive.
Thank you so much, Ele. So indeed, this was a very interesting journey that allows to go deep in many different dimensions. And what we would like to do now is to just give you a flavor of the type of analysis that we did, because it's extensive and it would take us too long. So if we can go to the next slide. What we did, discussing with people in our network, so the nurses in our network, for example, but also the existing literature, was to look at the different barriers that are experienced by nurses, pathologists, and so on along the patient pathway. So to make a concrete example, when it comes to the testing step of the patient pathway, we looked at different types of barriers. So we know that education and awareness are just one of the potential barriers, but we know that there are many others that can potentially hinder the implementation of precision medicine at the point of care. For example, structural barrier, communication barriers, informational barriers. So we're trying to make sense of this very complex topic in this way. One of the things, to give you an example of the challenges of nurses when it comes to biomarker testing, is, for example, the need to address the communication barriers around precision medicine. So what we often hear from nurses is that there are many patients that go to them after they receive the results from their oncologist to ask for clarification and to receive, to have an opportunity to address this type of complex information in lay language. However, nurses do not always have the resources, or do not always receive the support to actually being able to do this. It's a complex task to be put in front of. And at the same time, along the same lines, is, for example, the limited role that nurses have in decision making. So in many settings, nurses might still have recognized a small role in the care team, while they are often, as I was saying before, a very crucial healthcare provider in front of the patients. So this is an example of how we are trying to unveil the different types of barriers that nurses face. And as we were saying, we really did it from the screening until the testing the step of the patient pathway. And if you can move to the next slide, what we did next was then to look at for example, at the type of support needs. So from the challenges, we tried to look at, okay, what are the support needs that are, ideally needed at each of the steps, and how is it the best practices are addressing these needs. So if I continue with the example I gave before, nurses somehow still, would need access to decision-making tools and lay language resources that can help to address these complex topics with patients. So we identify that this is a type of support need, and then what we did is to say, okay, what are there any type of initiatives that do something in this space? Can we identify best practices? So for example, when we looked at the best practices, we saw that, for example, the Oncology Nursing Society has a biomarker database that is a tool that has been designed with the nurses in mind. And the idea is to really help to basically provide the most important information about biomarker tests, and really helps to also both in terms of clinical decision making, but also to be able to answer some of the questions that patient receive. And we also saw that there is an initiative from CTTI, the Clinical Trials Transformation Initiative, that promotes the inclusion of nurses in clinical trials, which we know is also a very critical moment in step in precision medicine, and that provide guidance on how nurses can contribute. And basically what we did next, if you can click again, Vince, was to look at, okay, what is missing? So we know that we have identified support needs, we have identified best practices, but we also have identified potential area of gaps. So perhaps area where support is needed, but where we couldn't identify so far best practices. So for example, one of the things that we realized that in many settings there is still a gap in actually knowing how and integrating nurses in the clinical, in the core research team, and also in clinical decision making. So this is just to give you a little bit of a flavor of what we've been doing. And if we can move to the next slide. What was very exciting, Celia Diaz and also Silvia, who is in this call, was also like very active and supporting in the process. We've been trying to connect with nurses from many places in the world. Celia Diaz from Spain was able to present the findings of this initial analysis at ESMO that was just passed in, now in September in Barcelona. And now we're trying to keep connecting with nurses worldwide. So as you see, this is a little bit the reach that we've had so far, but also the reach that we might have in upcoming conversations in the next few months. And we see that there is a big appetite. We see that there is potentially an unmet need to be filled. So we will continue this conversation moving forward, both with nurses, but also with pathologists. Because so far they were identified as initial focus areas in the healthcare team. And if we can move to the next slide. This is a little bit where we are, but we know that, we started with this analysis, we connected with a lot of healthcare providers, but we know that there is a lot going on in the environment. So we would also love to hear from you. We are always eager to welcome new people to join these efforts. We're always also very eager to hear about best practices or other initiatives that are doing great work and that we can potentially connect with. So I would like to stop here for now and see if there is any comment from anyone or question, clarification from what we just shared. Maybe we can also use the chat, and if you have any question, don't feel shy. We're happy to address them. But if there's nothing coming through, maybe we can move to the next slide. As I was saying, there are a lot of opportunities coming up. So what's coming up for us is that with the group of collaborators and healthcare providers, but also patient advocates and beyond, what we are trying to do is to think about how to transform the analysis that we did into a potential opportunity map, to be able to say, okay, these are the opportunities that we have to address the needs of healthcare providers, but also to leverage best practices. So for example, we are trying to identify ways to use an archetype approach, as Lidevi was sharing before, also to identify potential opportunities to replicate best practices in areas of need in similar context. What we'll be also doing is to continue the efforts to raise awareness of what we have discovered. So what Celia did at ESMO was just one of the first steps in sharing more broadly what we found out. And of course, there is Precision Medicine Awareness Month in November. So we will be busy to try to share this more broadly. So please connect with us and also connect us with key initiatives and champions in the space. Like we really want to gather around us people that want to think about how do we go about it, how do we collaborate to, for example, support peer-to-peer type of cross-learnings among healthcare providers, but also opportunity to share and replicate best practices. So yeah, join this group, let us know, and we're happy to involve you further. And I see Anan has her hand raised.
Yes, thank you, Sylvia, for this nice presentation. I just have a question because I'm discovering everything actually. So, but it seems to be really interesting. But do you plan to publish something around this topic? Because again, communicate during congresses is really interesting, but when you publish, there is more impact and the reach is higher. And we experienced this when we worked with a few nurses with an advisory board first, and then we decided to publish something. It was around the product, the management of adverse event in specific disease area. I will not mention which one and which product, but when we published the data or the insight and the advice and what the nurses shared during the advisory board, the impact was much higher than the Congress communication.
No, thanks for sharing. That's definitely one of the opportunities that we have. And I think it would be great to, when we convene with the group, to think about what would be the best opportunities to really bring these learnings, as you were saying, to maximize the impact of these learnings. So indeed, that the publication is definitely one of the opportunities that we have. And I think we have potentially in the network several nurses that would be interested in contributing to it and potentially also have other healthcare providers. So thanks for the suggestion. It's definitely something that we can bring back to the group, thinking about the next steps.
And I have just one more comment.
Yes.
I'm surprised by the low number of European nurses because, for example, in the UK, Sylvia worked in the UK, so they are much more active and they have more possibility. They can prescribe treatment. The practices are different from other countries, so I was surprised that there was very limited European nurses, only from Italy and Spain, right? Why you didn't? Sorry, I saw Eleonora mentioning something, but why you didn't
In Croatia.
succeed, or maybe they didn't want? Okay, Croatia, yeah.
Yeah. And I
well,
think we are still halfway through the process. So it was fantastic that Celia shared a message in a group, a nursing global nursing group. And she received like I think 50, 60 nurses that were
okay.
interested in actually coming together and being interviewed. So we might have more coming up.
Okay.
And what would be really great if you have nurses that you believe would really be interested in in being part of this group and thinking about how to move from talking about the gaps to how do we do about it, it would be great if you connect us with us. So indeed, please let
Sure.
us know.
Yeah, sure. I can share with you names that we worked with, and remember one which was really good from the UK. I know sometimes it's difficult to work with the UK person, but as an independent, because we were on the pharmaceutical side, it was more difficult, but it's always easier if it comes from you, and I'm sure they would be happy to participate. Yeah.
That's great. And I think in the same way also with pathologists, I think we have a much broader reach now. In the past year, we were able to connect with more.
Yeah.
We are really eager to connect with even more and create a little bit of a community of practice as well. So one of the thoughts for next year is to, have a bit of a safe space where healthcare provider can meet and discuss like the challenges that they face, but also a space where they can hear about how others made a change, how they implemented strategies that helped to somehow change how the practice works in their hospital. So we know that practice is different from one context to another, but the idea of having a moment, we hear a lot of appetite to have a space to have this type of discussions and to have this type of problem solving type of way to brainstorm. So it would be great if you can help us to connect with even more healthcare providers. Thanks, Anan.
Pleasure. And I will stop. I will let the other comment. Thank you.
Any other question or suggestion?
I'm sorry, I just figured out that I've met some people from Turkey, in instance. So those are nurses involved in clinical trials, and maybe this would be a good group also to include. So I could contact them and see if they're up to it.
Yeah, absolutely. Yeah, thank you, Ivica. That would be great. And I think you also have a nice reach in Eastern Europe, which it would be really good to make sure that we can include more and more. So we already have some, but it's good to make sure we can broaden the reach. Thank you. Great. So maybe we can move on. And please, if anything else comes, we will be sharing the slides and so on. But if any other question comes, you can write to us in the chat or also connect with us afterwards.
Thank you, Silvia and Ele. I have the pleasure to talk to you about a little bit around the activities that we're doing in our first strategic impact area at the system level, building the accessibility conditions for precision medicine. And to start with, we have two updates on the fronts that you see on the slide. On the one hand, we are looking into elevating the recognition of patient experiences within health technology assessment decision-making. We've started this year with a patient engagement open forum session where we thematized unlocking the human element. So understanding better where the patient experience and perspective really fits within the HTA decision-making. And just recently, we have concluded a landscape mapping and are in the analysis phase. And first insights suggests or guide us towards looking into HTA guidelines on preferred patient experience data collection methodologies. So FT3 is looking into understanding better how we can streamline and support harmonization around the process of building robust collection methodologies that could be used by patient groups and other actors to collect patient experience data in a comprehensive fashion. On the other hand, you see that earlier this year in July, we've conducted our first Value of PM Access and Advocacy workshop. This is supposed to be a series combining and providing a shared space for our access and advocacy and value of PM projects. There we're looking into bringing together change agents, just like yourselves, to discuss how different perspectives on value-based healthcare can be brought together and packaged for precision medicine champions to make a change where they are and enter into dialogues with their local decision makers, be that policymakers or HTA bodies. The first workshop that we had this year featured Dr. Lou Garrison, and he was talking about novel value drivers and their utilization in HTA decision-making, or the lack thereof, and how novel value drivers could inform a more holistic and broad assessment of the value that precision medicine can ultimately provide to patients, the care system, and also society at large. We're looking forward to organizing another second workshop in that series. This will probably happen at the beginning of next year, and we will focus more particularly on peer-to-peer support among global and local patient organizations. Now we'll look into the two projects that make up this shared space, and I'll start with the Value of PM, where we look to support a paradigm shift from traditional assessment toward value-based care especially with a focus on novel value drivers and how they can be employed in value assessments at the system level to further the access to precision medicine for patients who could benefit. As just said, we started with workshops and discussions in the project group to understand the role that FT3 could take. And in the past months, also with the help of the Strategic Advisory Board of FT3, it crystallized that we should focus on the co-creation of global principles for value assessment and pricing. So really taking the global role in terms of furthering harmonization among the key stakeholders that are relevant in shaping value assessment for precision medicine. At the same time, we are also looking into strengthening the synergies between this project and the Access and Advocacy project, not only with the workshop series, but also by packaging information on novel value drivers and the needed and associated evidence for them for advocates and PM champions that want to use novel value drivers to make the case for precision medicine with their decision makers. So for that, we're looking into integration with the advocacy roadmap that shortly will be presented as well. We have a first draft of the information sheets, although the format may still change, and afterwards you can, when you receive the slides, you can explore them, and we would be happy to receive your feedback. If you want to get involved in this project, please contact us or me in particular so that I can make sure to include you in the project group calls. And if you have great contacts that are former or current HTA experts, policy experts or payer representatives, please reach out to us, and we would really appreciate an introduction with those people, as they are key to further developing our role in co-creating global principles for value assessment. I'll stop here for a second and see if, given the new direction or the confirmed direction of travel, if there is someone of the group here that would like to make a comment on this project.
I'll jump in. This
Thanks,
is Alan Balch with the Patient Advocate Foundation. Thanks, Vincent. Great work. Could you say a little bit more? Obviously, I was one of those who endorsed the idea and really touted its value potentially. So in terms of creating a set of global principles for HTA assessment, especially around how to do it in a person-centered care from the lens of precision medicine as well as person-centered care. Really like the idea of also combining with that a set of methodologies that could be deployed in those HTA assessments, or associated with those novel drivers, which is also obviously connected to person-centered care. Do we have like an advisory group for the methodologies, or maybe is that just something? I think I know the answer, but that's just combining those two efforts. Is that going to be a 1-2 step, or are we going to try to do all those, both of those things together, the principles as well as the common methodologies that could be attached to that are associated with the novel drivers?
Thanks, Alan. Really appreciate that you bring that up. And yes, indeed, when we look into the novel value drivers and how they can be employed, of course, one of the biggest barriers that currently exist is that there's a lack of consensus around which methodologies to use for the incorporation within HTA decision making. And so indeed, it is one of the aspects we are hoping to address with those global principles. As you're asking for an advisory group, of course, we have the project group on this project. However, we are looking to build a task force that could drive the efforts around global principles. And there we are, of course, in contact with some key experts, including Lou Garrison, for instance, and representatives from HTAI. However, I'd be happy to hear your thoughts, but also other people's thoughts on who would be a good partner for inclusion. And Alan, of course, we're counting on you for your further support in this direction.
I'm actually here at a meeting with Lou Garrison, so maybe he and I will huddle this afternoon over lunch and brainstorm a little bit.
That would be fantastic.
I see
All right.
there is a question in the chat from Sushmita. If you want to take it now.
I see. It's about the EU HTA regulation. So Sushmita, thank you for the question. I'm gonna address the EU HTA regulation quickly. Our membership has so far been hesitant to dive deeper into the specificities of the HTA regulation in Europe, especially because we anticipate a time of uncertainty, how that will be implemented and how that will impact the HTA landscape in Europe. So we were urged to take a patient approach to seeing how the HTA regulation rolls out, and then eventually tackling and understanding better, and then tackling how that can fit within the framework of that regulation or the impacts that it will bring. I hope that that answered your question, at least to that piece. And please connect with me if you want to continue that conversation. I'd be more than happy to.
And just to add to that, Shushmita, the PCC access work stream last year published a value framework for assessing the value of CGP that was specific for Europe, adapted from a Latin American framework. So if you're interested, I can send you the link to that poster that was presented last year.
Thanks, Andrea, and certainly a big piece of inspiration for us as well. Yeah. That work. All right. Thanks so much. And with this, I will hand over to my colleague Jonut, who will be speaking about the Access and Advocacy Project.
Thank you very much, Vince. So for those of you who don't know me, my name is Jonut Rotaro. I work within the FT3 starting this year. And to do a short recap of the Access and Advocacy Project, when it comes to the long-term goal, the project aims to support the conditions for personalized healthcare and precision medicine by empowering champions to drive system-level change for better access in their countries. And what has been happening this year is that within a project work group with 20+ experts from different stakeholder groups, we have been co-creating an advocacy guidance or toolkit to help local champions identify what they can do to actually make personalized healthcare an accessible reality where they are. If you look on the right-hand side of the screen, you would see that there is a small screenshot of how the roadmap looks right now. And when you'll be receiving the slides, you'll be able to actually click on the slide and see the whole visualization of the roadmap and understand how each module of the roadmap connect with each other and make, at the end, a comprehensible advocacy planning that can be accessible, ideally by anyone that wants to drive precision medicine advocacy in their work. Now, in terms of latest progress, we have been working on the module 4, which is the evidence module, where we have been conducting a comprehensible mapping that emphasized the fact that we need to emphasize the significance of linking specific types of evidence to relevant issues and decision makers. And this type of mapping will inform the co-creation of the evidence module further. When it comes to module 2, we have been able to actually co-create it further and started testing it. We have started testing it in the Hungarian context, and the advocates in the Hungary context with which we have been able to test the module have been reporting a deeper understanding of their health system and felt more equipped for advocacy planning. Currently, we are also exploring the testing of the module in the Philippines network, and we are trying to see what other opportunities we have for testing the module further to make it fit for usage and fit for purpose. When it comes to the help that we will need from your side is to support us in co-creating the next module on the evidence-based advocacy. If you have any tools or any resources or any materials or contacts that will help us build upon the evidence-based advocacy module, feel free to share it with us. And if you also have any idea on where we could potentially test the roadmap further, please contact us and connect with Sylvia to further discuss how we can make it happen. Before I move on, I would like to take a pause and see if there is anyone that would have any comments or any questions on this particular project.
Comments. I've been participating in the both the PM access and advocacy groups and the value of PM. And I'm from Oncoguia, which is a patient advocacy group. And I just want to say it's been a really interesting experience for us. And I think having the technical sheets and having the technical support for us to present to local stakeholders on the value of PM access, it's going to be really important for us. And I think it's going to be a very interesting project for us to use on our daily activities. And I'm very curious about the first draft of the information sheets that was mentioned earlier. And I'm excited to look at it, and especially since now in Brazil we're having a HTA process is like a very hot topic, and I think it's going to be very useful.
Great. Thank you very much, Perla, for commenting, and we really appreciate the support of Onconguia in both the projects that have been mentioned. I don't think there is anyone else, and I didn't see any question or comment in the chat. So if there is no other question or comment, I will pass it on to my colleague Sylvia to take you further with the next projects.
Thank you, Jonat. If we can move to the next slide, we wanted to give you a bit of an update on what has been happening in the past few months and in general in 2024 when it comes to testing some of the tools that have been co-created in the past. So some of you have been with FT3 in a long time and would remember the time when we were really co-creating the adaptable resources. Well, now they are, they are being tested in the real world, and it's really nice to see the type of intelligence that we are gathering by bringing it to different type of contexts. And for example, the adaptable resources have been used in Spain, in Hungary, in Canada, in Nigeria as well, and we are learning many different things about their implementation. And at the moment, what's really interesting is to see how to bring them to a context like Nigeria. So what we are learning is that there is a lot that needs to be potentially adapted to make sure that we also make it fit for purpose in terms of, based on the cultural background and the cultural context that we bring them in. So this is something that is ongoing, and we are learning a lot and look forward to even learning more. So we will have some focus group with patients, but also with healthcare providers in Nigeria, where we can really learn how to bring such resources to promote patient empowerment and awareness in contexts like Nigeria. We are also having a pilot in Canada, and what we are doing in Canada is to basically bring the learning from the Hungarian country pilot, where we have brought these adaptable resources to the clinical setting. And at the moment, there is a great collaboration there to see how to test it in different hospitals in Canada, and how these adaptable resources can really help to support patient-provider communication and shared decision-making. So this is ongoing, and we hope to have something to share more in terms of feedback very soon. And at the same time, if we move to the next slide, it's really nice because as Elena shared at the very beginning of this meeting, there was a lot of work into the biomarker test report summary template. Just as a reminder, this is a summary template that is supposed to come with the biomarker test report. It's not supposed to necessarily completely replace it. And the use of this tool is to support pathologists on call to bring information about biomarker test report in a way that is understandable for patients. So again, it's really about also improving shared decision making and the confidence of HCP around biomarker test report and precision medicine. So what is very nice to see is that from co-creating a tool, now we're really moving into the piloting and bringing it to the real world. And We will be piloting in Italy, but also in Argentina. I see that Hernan is here with us. So we are very excited about the work there and the energy that there is around, testing and being open to learning how to make it even better in the future. So we are really happy to see, and we're also looking for additional opportunities. So potentially additional testing opportunities where we can see how this tool can help, maybe also nurses. We were talking about nurses before. Is there an opportunity that such a tool could also support nurses in supporting patients in the right way? So many things are coming up, but it's exciting to see that we're able to test soon. So maybe I'll stop here and see if anyone has any question or any addition to make. Ivica, I see you raise your hand.
Yes, well, I would just like to say something about the background of this, because people who are dealing with PM are a small group and not necessarily a lot of healthcare professionals know a lot about it. So we need to empower them first to be able to give the information to every patient, because they have to adapt to the level of understanding that each patient can take. So we were also all thinking that patients are like people who are sitting in the FT3 and who are really engaged, really passionate about the PM and know a lot about it, but people don't. So we need to adopt those tools so it will be understandable to a broader audience. On the other hand, it's also very important to be understandable to the HCPs, and so it's kind of bringing it to the everyday clinical practice.
Absolutely, that's an excellent point, Ivica. And I think that these opportunities to pilot will really give us those type of insights to see like how do we make them for the average, person that would find themselves in that situation. So that's a very excellent point. Thank you. Hanan, I see you have your hand raised as well.
Yes, thank you. I wanted to ask if there is if this final draft can be shared externally. If we want, for example, to find these relevant partners, we need to share with them something, few slides, and maybe this report, and if it's possible to share it externally, our side.
Absolutely.
Okay.
Yeah, we can definitely share it, and perhaps in the follow-up of the town hall, we can also include some useful links so that you can find it easily. So absolutely.
Okay.
And happy to have a follow-up conversation. I'm curious to hear the ideas that you might have. Yeah.
Yeah. Thank you.
Great. If there is no other comment, perhaps I can hand it over, I believe, to Elena to drive us through the next slides.
Yes, so I'm going to continue with the theme of testing and piloting in real life. So I will be diving more deeply into this goal 3 that I had presented at the very, very beginning. And we will be discussing updates in a bit more detail with the country pilots or demonstration pilots, which you will find on the next slide. So there are lots of exciting progress. It's difficult to distill it all. If you could just go to the next slide, please, Vincent. We wanted to share that with Spain, we had been talking about the fact that we had been working towards a multi-stakeholder roundtable, and that is finally happening this month, which we're really excited about and look forward to sharing the outcomes with you. I can also share that with the Philippines, we're progressing with developing resources to help train interventional radiologists to support their capacity building to be able to have better outcomes for patients and supporting the testing procedures. So a lot of great things happening there. I also wanted to share that in the FT3 meeting in Barcelona, we had a lot of great discussions about what can we do more of with country pilots, or rather demonstration pilots, because we kind of confirmed that what we can potentially do really well that no one else can do is to have more and more learnings or identifying successful interventions that can be applied across different geographies or different contexts. And so we had a really good discussion about what that could look like. And essentially it is doing something similar to the country pilots, but starting with, what is the need, and then looking at the countries as more like a blueprint. So kind of difficult to explain quickly, but what I wanted to invite you, we are going to be doing some consultations in the next few weeks to understand where you see as an opportunity to be able to make learnings in a certain context or country model. So if you are interested in this topic and would like to discuss further, if you have kind of identified already a kind of pattern, you know, a given kind of country type where you see persistent issues and you think this could be an interesting case for us to look into more detail, or perhaps it's a particular barrier area. One of the ones that we're hearing right now is around capacity building for pathologists and labs. And what is it that we can do there so that each time it's not like its own intervention, but we can build something scalable that can then be more easily applied to other kinds of similar situations. So if you have any ideas around that, we'd be really happy to hear from you. You can contact me or any other member of the team, and we'd be happy to talk through this with you. So I wanted to share both that update and invitation to get involved. And with that, maybe we can move to the final slide because we're doing well with time today, surprisingly. We wanted to end with this usual call to action, the different ways that you can get involved. So of course, we have the production subgroups. The detailed updates that you got today are the fruit of the work that's happening in the production groups. And if you're interested in any of these topics in particular and would love to roll up your sleeves and get involved, we're really happy to have your participation. And indeed, if you have any colleagues who you think would be a good fit, we are completely, everything we do is co-created, so we rely on your expertise, and that is what's enabling us to reach our objectives. And then we are also always looking to increase our reach. This is something that's important for us to be growing the FT3 community of practice, and to be able to reach our objectives, we do need to reach specific kinds of people with expertise, or let's say influence, and working in different kinds of circles. We've made a lot of good progress recently, but we are keen to continue that good trend. So if you have any connections or ideas of how we can bring these groups closer, we'd be happy to hear from you. And last but not least, if you haven't discovered Precision signups already, we would really encourage you to have a look. If it is seeming overwhelming for you and would like to have a one-on-one demo, let us know and we'd be happy to walk you through and help you get started. And as I mentioned, we'll be back in touch with an update in the next few weeks as we are looking to see what we can do to make it even more easy for you to find and champions like yourselves to find information that's relevant and helpful for you according to the different kinds of information you might have. So more is coming with this, so stay tuned. And again, if you're looking for some help to get started, just let us know and we'd be happy to explain that to you. So that's it from me. I don't know if there are any final comments or questions. But I was very happy to have this opportunity to connect with you. For many of you, the first time since I saw you in Barcelona. So thank you for that opportunity. And we're always here for any help. Please stay in touch. And I hope you have a wonderful rest of the afternoon or day or evening, depending on where you are.
Thank you so much. Nice seeing you, everyone.
Thank you.
Bye-bye.
Bye.
Guys,
Thank
bye.
you.
Enjoy, everyone. Bye-bye.